Hello everyone, I am going to talk about a condition that everyone would experience. Have you felt worried before a job interview, a performance, a first date, an exam, childbirth, or any number of important moments? You might feel fear, tenseness, restlessness and even shaking, nausea, sweating. It is called anxiety and you are anxious, but you must realize that it is just normal. It is the body's normal response to such situations. It is short-term. However, these anxious conditions become worse. You can't do your daily activities and it lasts for a certain period of time, or for a long time. It is not normal. These symptoms might be a part of anxiety disorders, which are mental health illness and disease. There are several types of anxiety disorders. They involve both similar symptoms and some different symptoms. Some common symptoms of anxiety disorders are excessive fear and worry, muscle tension, irregular heartbeat, difficulty in sleeping, nausea, avoidant behavior, avoiding feared situation, panic attacks. Anxiety can also accompanied with depression. Its symptoms. Different types of anxiety disorders are generalized anxiety disorder, social anxiety disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder also called PTSD, and, finally, other anxiety disorders like separation anxiety, specific phobia. In generalized anxiety disorder, people feel excessive and persistent worry, fear, and anxiety. They are hard to control, and there is no specific reasons for this fear. It means you fear, and you are anxious for no reasons. Its symptoms include consistent worrying, anxious, restlessness, fatigue, concentration difficulties, you can't concentrate on your work or daily activities, muscle tension and ache. Social anxiety disorder, previously called social phobia, is characterized by excessive fear of social and performance situations. People with this feel intense anxiety around meeting new people, in relationships, speaking in front of others, eating in public, and more. They try to avoid these social situations as much as possible. These social situations are normal to normal people, but for them, they fear intensely without reasons. They also might have blushing, sweating, nausea, trembling, rapid heart rate, self-judgment and self-consciousness. They judge themselves too much without fair reasoning. They also try to escape to the situations. These might even cause impairment in their social, occupational, and other areas. In obsessive-compulsive disorder, also called OCD, unwanted thoughts that could not be controlled are recurring for most of the time and that lead to specific and repeatable actions, which interfere with daily life. It includes obsession, in which thoughts and worries are excessive and won't stop. For example, a person fears germs almost experiences thoughts of germs he feared, feels stress, anxiety and then scrubs his body or washes hands repeatedly to remove these germs. These repetitive behaviors are performed to relieve his stress and they are called compulsions. These actions and thoughts occur minimally for 1 hour per day. In panic disorder, a person suffers from recurrent and unexpected panic attacks. A panic attack is an episode of extreme fear and discomfort accompanied by a variety of physical sensations like sweating, chills, trembling, heart beats rapidly and feel heart palpitations, chest pain, shortness of breath, feeling choked, feelings of impending death. In post-traumatic stress disorder, PTSD, it is a type of anxiety disorder. After facing a traumatic event such as serious injury, combat, sexual violence, natural disaster, or actual or threatened death, you start to experience anxiety symptoms although these events are not currently present. Symptoms of PTSD include detachment from others, irritability, hypervigilance, difficulty concentrating, difficulty sleeping, difficulty remembering the traumatic event as they try to forget this event and avoid things which are associated to the traumatic event. Although they try to forget and avoid intrusive symptoms, such as recurrent and involuntary memories, they appear. Psychological distress when exposed to triggers. They start to have negative beliefs about oneself or the world. Persistent negative emotions such as fear, horror, and guilt. Persistent inability to feel positive emotions such as happiness and satisfaction. Self-destructive behaviors. It is usually seen in some military personnel, who have fought in combat and experience PTSD. In complications of anxiety disorder, if left untreated, anxiety symptoms can be worsened over time. Due to fear of symptoms or anxiety attacks, you may start avoiding situations that were previously normal. This can lead to social isolation. The symptoms get worse and worse, and at worst, they might attempt suicide. So, early recognition of symptoms and appropriate treatment is so important. Worry, fear and being anxious is a normal part of life, but when they becomes consistent, and more intense according to the situation, interfering daily activities. Avoiding situations like not going out in public, not answering phone calls, or avoiding meeting with friends, canceling performances or presentations, or not able to sleep. It is recommended to see a healthcare provider, mental health counselor or your doctor, and getting diagnosed and appropriate treatment.